Have you ever stopped to truly ask yourself whether the way you connect with your body, especially in your most private moments, still aligns with what your body needs now? After 60, everything changes. Your energy, your rhythms, even the subtle ways your body responds. But how often do we pause to honor that change? Most men don't. They carry on with habits formed decades ago, unaware that what once served them may now quietly be working against them. This isn't just about physical pleasure or sexual activity, it's about health, dignity, confidence, and the lifelong relationship you have with your own body. And yet, this topic often lives in silence, buried under embarrassment, confusion, or fear of judgment. Let's get honest. It's not about asking whether self pleasure or sexual expression is still okay. The real question is deeper. How can you embrace this part of your life in a way that supports your health, protects your body, and sustains your confidence as you age? Because mature male sexuality is not something shameful or unnecessary. It's not a flaw, not a bad habit, and certainly not something to give up because of age. In truth, it's a fundamental part of well being when done with care, awareness, and intention. When self pleasure is approached consciously, it becomes a form of self care. It promotes blood circulation, particularly in the pelvic region. It keeps the prostate active and healthy. It supports hormone balance, regulates stress hormones like cortisol, helps improve sleep, and calms the nervous system. And these are not myths. They are medically documented benefits. But what worked at 25 might not work at 65, and that's completely natural. Our bodies evolve, our hormones fluctuate, our sensitivity shifts, and our recovery slows. Yet most men never update their habits to reflect this evolution. Instead, they hold on to methods from their younger years, expecting the same results, and when the experience changes, they blame themselves. You don't need blame, you need adaptation. Let's look at what truly changes. Over time, blood flow to the pelvic region can slow, nerve endings become less responsive, testosterone levels decrease, and connective tissue in the penis and surrounding muscles lose some of their elasticity. None of this means the end of pleasure. It simply means the body needs gentler care and deeper understanding. Unfortunately, many men still treat self-pleasure like a race. Quick, secretive, rushed, something done in shame or tension. But that approach actually activates the body's stress response. When you rush, your sympathetic nervous system, the fight or flight mechanism, takes over. Blood vessels tighten, muscles stay contracted, and your mind disconnects from the experience. That's why after rushing, so many men feel more anxious than satisfied. The body was never allowed to relax. But slowing down changes everything. When you slow your breathing, give yourself time, and allow presence instead of pressure, the parasympathetic system, the rest and restore system, activates. Blood flows freely. Muscles release tension. Sensitivity deepens. What once felt mechanical becomes grounding, healing, or even meditative. It's in this calm state that true pleasure and health benefits intertwine. Another challenge many men face is declining sensitivity. With age, natural testosterone levels and nerve responsiveness decline. To compensate, men often begin using more and more pressure or faster movements. It might work in the short term, but in the long term, it can desensitize nerves, strain blood vessels, and cause microtrauma to delicate tissues. There's even a recognized condition known as death grip syndrome, where only one specific intense type of stimulation triggers a response. Over time, this can make intimacy with a partner difficult or unsatisfying because the body has learned to respond only to artificial pressure, but the body can relearn with patience. The key is gentleness. Use lubrication to reduce friction and support the skin's natural elasticity. Choose fragrance-free, high-quality lubricants that mimic natural moisture. Focus on lighter touch, slower rhythm, deeper breathing. Think of it not as a mechanical act, but as a therapeutic massage for your circulatory and nervous systems. Within a few weeks, your body begins to respond differently. Sensitivity slowly returns, and pleasure feels more natural and connected. But perhaps the most overlooked part of this entire conversation isn't physical, it's emotional. For many men, self-pleasure is wrapped in decades of shame. Old beliefs, religious teachings, or social conditioning have turned it into something secretive or wrong. Even in adulthood, those emotional imprints remain. And when shame lives in the body, it shows up physically, in tight muscles, shallow breathing, and restricted blood flow. Science supports this. Chronic emotional stress interferes with the body's hormonal balance. It reduces testosterone, suppresses nitric oxide, the compound responsible for healthy erections, and increases inflammation throughout the body. That's why emotional healing is just as important as physical technique. Give yourself permission to accept this part of your life fully. You are not broken. You are not past your prime. You are not doing anything wrong. You are simply entering a wiser, slower, more intentional phase of connection with yourself. Let go of the old belief that performance defines your masculinity. At this stage, presence is far more powerful than performance. Every breath, every gentle touch, every moment of awareness is an act of self-respect. And that's the real transformation. Shifting from doing something out of habit to doing it as a ritual of health. If you want to build a healthy self-pleasure routine that truly supports your well-being, start with self-care, make it intentional, choose a clean, quiet, private space where you can relax without distractions. Turn off your phone, dim the lights, and allow your nervous system to unwind. Take your time. Slow breathing activates the body's relaxation response. Pay attention to sensation, not just stimulation. If you notice discomfort or pain, don't ignore it. Listen. That may be your body's way of signaling tension, dryness, or circulation issues. Hydration also plays a surprising role. Dehydration affects blood flow and tissue sensitivity. Drink water regularly, especially before and after any intimate activity. The body's fluids are essential for healthy function, inside and out. Another often forgotten element is exercise. Gentle pelvic floor exercises such as Kegels can strengthen the muscles responsible for erection and ejaculation control. Combined with stretching and deep breathing, they support circulation and help restore vitality to the area. Now let's talk about emotional connection. You may not have realized it, but touch releases oxytocin, the hormone of connection and bonding. Even when experienced alone, it calms the heart, reduces anxiety, and creates a sense of peace. For older men who may live alone or feel isolated, this kind of intentional self-connection can profoundly support emotional health. The truth is, sexual energy never disappears. It simply transforms. It becomes quieter, wiser, and more deeply connected to emotion and intention. You can still experience pleasure, perhaps even greater pleasure, when you learn to listen to your body instead of pushing it. Age does not erase desire. It refines it. And here's something rarely discussed. Consistent, healthy self-pleasure supports prostate function. Ejaculation helps clear the prostate ducts, reducing the buildup of fluids that can lead to discomfort or inflammation. Urologists have long observed that regular sexual activity, solo or with a partner, correlates with better prostate health in older men. Beyond that, it also supports hormonal balance,